Yeah, and having a baby at the moment is just such a challenge.
Are
Yay!
We
are live. How exciting. Thank you so much for having us.
Thank you everybody. Thanks APBC. Okay, so I'm just going to go to start with, here's Kat. We're actually on half term at the moment, but Kat is a vet. What do you usually do, Kat?
So I am a small animal vet and have been for quite a while now. I'm based up in Sheffield. I run the social media pages Kat the Vet, and so I talk a lot at this time of year about fireworks and pets and all that kind of thing. And I'm not a specialist in behaviour, but I have a reasonable interest in it. I think, you know, when you're a vet in clinic, so much of behaviour comes up in general conversation, doesn't it? So I'm a big fan,
really, doesn't it?
Yeah, exactly. I'm a big fan of the APBC. I'm a big fan of referring to specialists like yourself, Hannah. So thank you ever so much for joining me. But of course, you're a vet and a behavioural specialist.
I am based down in Bedfordshire, and I am a GP vet. So at the moment I locum for various places. Haven't done much during lockdown. Just had my first baby, 6 weeks old, so I haven't done much vetting lately, but I also see behaviour referrals for horses, dogs and cats as well. So yes, thanks for having us APBC. And for now, I think we've had some questions come in beforehand, so we'll have a little look at those and see if we can provide some answers, and then see if some more come in during the session. So Kat has written, she's hoping to be able to join us, but are there any meds suitable for a 5-month-old rescue who is noise sensitive and fearful, or are meds contraindicated for such a young dog? Very good question.
That is an excellent question. It wasn't me that wrote it. I can't take the credit.
Sorry,
for that. Another cat.
Ridley Hughes, I think. So very good question. I think looking at all of the data sheets, nothing does seem to say a certain age for contraindications, except when an animal is lactating or pregnant. So no, 5 months old, I would definitely be considering using meds for that animal, as well as obviously managing the whole environment. And at 5 months old, you might be questioning, why are they sound sensitive? So again, we're too close to firework night to be doing any kind of deep investigation, but behaviorally you would want to make sure that they have the least traumatic time around firework night as possible. Otherwise they will just sensitize even more to noises and just get worse in their life. So yes, medication seems to be fine to use. I've used it in much younger, and in that situation you might consider one of the licensed medications for that event at the time, so perhaps Pexion or Soleo, the gel that you rub on the gums, and ensure that you perhaps have enough in stock to do every night that's going to have fireworks. You know, just give it anyway as preventative, and if there aren't many fireworks that night, then great, but don't risk a night of not giving it and then potentially sensitize the dog and have a worse time, you know. So
well, I think that's really, first of all, I think that's really perceptive to pick up that a 5-month-old puppy is noise sensitive, and I think there is a much, you know, there's a bigger story than fireworks there, isn't there? You know, if it's 5 months old, so where are we now? We're like October, November. It's been born in May, you know, April, May time, hasn't it?
And
nothing noisy. Yeah, exactly. Nothing noisy has happened. I'd be wondering, exactly. This dog has clearly had a very difficult start in life. You know, has it come from abroad? Unfortunately, a lot of the pups, I don't know about you, but I see a lot of dogs that have come from other countries that are, you know, have obviously had some really, really difficult experiences.
Usually completely traumatized.
Exactly. So I think there's a bigger story there, isn't there? And I think your advice of, you know, medicating whether there's noise or not is absolutely the right thing to do, because I think a lot of people, and you know, it's interesting, she's asked if it's licensed and it's safe. By 5 months old, your puppy is functioning on an adult level, aren't they, really? From, you know, the things that we worry about as vets, or consider, not necessarily worry, but consider as vets, are things like kidney function, liver function, that sort of thing, isn't it? And they're all completely up and running.
Yeah.
The drugs that we use, even if they have got problems, the drugs that we use are really safe. So they are, you know, exceptionally safe and incredibly effective. And I think this discussion comes up every year. We all talk about making them a den and plugging in an adapter and doing all of that, but for the ones that are stressed, we just need to give them the drugs.
Yeah,
that's my attitude, because
no, we need to be as preventative as possible, because the more that they experience a traumatic time, the more sensitized and more fearful they'll be for the next time, because they'll feel like they didn't get a safe result from it, you know. So they were correct, they were right to feel fearful almost, and the next time they will be even more fearful, because they'll realize they didn't have any control of the situation, and they couldn't find a cure, they couldn't find safety. So as well as the safe haven, which will be very important for that pup, if they've been in shelter, which is almost kind of living outdoors, but also with excessive noise and other dogs barking and sounding very distressed next to them, then that can also make dogs, if something scared them once, it could have been something little, they then may have, over time, nothing's been resolved for them, they're still feeling fearful, and they've kind of had almost a trigger stacking situation in their lives, and then they can revert to actually being what you call generalized anxiety. They were once fearful of one thing, and then it's become everything, you know, that noise there, and the wind and the rain and everything, you know, other dogs. And so that 5-month-old, I would say, get on top of it now if you can. So yes, get some event medication that, you know, prescribed for that animal now. An event, I mean, it will work quickly, and then perhaps refer to a qualified behaviourist for some long-term help on that one.
Yeah, precisely, because we're so last minute now, aren't we, regardless of how old
and owners
your dog is.
Well. Yeah,
you
know,
exactly.
Owners don't always realise.
And I think that thing about trigger stacking is, you know, that's quite a technical term, isn't it? But when you break it down again, you can understand that, you know, if you know, as a human, if your job was stressful and stressing you out, and then you got home and it was awful and that was stressing you out, and then you were having to worry about, maybe some people are like paying the bills and then going, you know, and everything in your life was just a real challenge, and you never ever had any space to relax or calm down. That's exactly the same scenario for our pets, and particularly our dogs.
Yeah, and it could be just a small trigger that sends you over the edge, you know, that sends you over your threshold, because if you're already got a few things going on, perhaps if you just had that one thing going on at one time in your life, you could cope with it. But if then, you know, say for example, you've got a painful leg, you know, from a dog's point of view that day, and then it was raining and thunderstormy as well, so you're almost, and you don't like that, and then the neighbours' children came round, so that was a third big thing, and then fireworks went off. Well, with all of those things at once, that's trigger stacking, and it's all happened all at once, and you just can't handle it, you know, you've been pushed over your threshold.
And I wonder if, do you think that's why, because one thing that I see sometimes is I see dogs, we'll try and talk about cats as well, but you know, other animals, but I think it's really our dogs at this time of year that really struggle, isn't it? And so you get these dogs that have always been fine with fireworks, and then suddenly have a really, really bad experience, or really suddenly out of nowhere seem stressed. And I always wonder, well, has that dog always been fine? Or have they been teetering on the edge, but have been able to cope with life or fireworks, and it hasn't, you know, they haven't had enough, and then so now, and suddenly the fireworks are just that one thing, that one big thing too many.
And often if you get an older animal, and that's happening, you might want to consider pain definitely as a contributing factor, because you know, very often they've now found links between chronic pain and sound sensitivities. So that is something for all of us vets, vet nurses, receptionists, anyone who's working with animals and seeing them daily should think about anyway. But yeah, pain can definitely lower your tolerance for things, you know, as we would, same if we had a migraine, or if we had, you know, we're just not up for noise or up for, well, we're less tolerant of everything in our lives. So yeah, definitely consider pain, consider arthritis, you know, consider things like that as part of a contributing factor anyway.
Yeah, I think that's really interesting, because I think a lot of people, they get an older dog and they think, or they have an older dog, you know, so there's one of two things happens with older dogs in my experience. One, if they've always been really awful and then they go deaf, and suddenly it's like the clouds part and the rainbows shine, because they can't hear the silence anymore. So they don't, you know, when people say, oh God, it used to be every year and now it's absolutely fine, she's gone completely deaf, it's wonderful. Or they seem to get worse. And yeah, it's that I as a general practitioner are now, there was a really interesting study, wasn't there? I think it was Sarah Heath that did it, and that says they've discovered that about 70 to 80% of behavioural problems in animals have chronic pain as a factor. It's humongous. And so, you know,
it's very, it's very under noticed, under diagnosed, you know, unseen. Owners don't particularly see it. You know, they see their animal every day, so they don't really notice, or if they do, they might think, oh, it's just getting old. But that's not really the case, because old isn't a cause of pain itself. You know, it brings about other diseases, you know, disease processes. But what we have to remember as general practitioners is doing a 10-minute consult where you pull the legs and neck around and things like that, and say, oh, they're fine, I can't see any pain. Acute pain might show up in that way, but chronic pain wouldn't necessarily, especially if the dog finds being at the vet's quite scary and is kind of in shutdown mode, freeze mode, or quite a stoic dog. You know, we aren't going to see it on pulling them about. So the only way really to know, because even when you do further imaging, and you know, there's not always a correlation between how painful the animal feels, so you know, physical signs with what we find on x-rays, or you know, so some dogs can have terrible x-rays and be completely bouncing off the walls and seem happy and comfortable, and other dogs might seem so painful and their x-rays look perfect. So it's not always, for us vets who like a black and white answer, it's not always black and white. But yeah, the best way really is to do an analgesia trial. And again, with regards, and I know we're going off topic a bit here, but with regards to sound sensitivities and things like that, it's really important to make sure that the analgesia trial goes for long enough. So I usually say about 8 to 12 weeks, because if an animal has chronically learnt over time that situation is painful, it's going to take them a lot longer to unlearn it, you know, when the pain's gone. So a quick 1 week or 10 days is not enough.
See, I think that's really interesting, because yeah, that's what I say. The best way to figure out if pain is there is to take it away and see the difference in your pet. But I think that's where your behavior brain is coming in and teaching me something, because I generally do put them on a 2-week trial. And to be fair, I think that's an easy sell to pet or easier sell to pet owners. But yes, there's a learned behavior component to chronic pain.
Yeah,
you're absolutely right.
Yeah, they're anticipating, if it's been happening for years and worsening, that, you know, they're not going to realize it no longer hurts anymore, and it's going to take them quite a while to learn.
Yeah, of course it does. They're going to have to learn. And I think that anticipation is what's really pertinent to fireworks, because the way chronic pain comes in is you're already a bit achy and you're lying on the floor in, you know, in the living room, and then what do you do when you hear a big loud bang? What do we all do? And we jump. And if your joints are all a bit sore, that sort of achy pain that you're living with, then you tense, and it becomes a lot sharper, doesn't it? That's how I understand it.
Yeah, and then they can't settle either.
Pain comes.
They're kind of panting, walking around, and then they've also got locomotion.
Exactly. And our animals are so clever, you know. So one night they might jump at the fireworks and hurt themselves a bit, or feel a bit sore, and they'll not yelp, they'll not squeal, they'll not cry, they'll just be like, ugh. And then the next night they'll hear a bang and instantly become even more frightened, because they don't, you know, I think although they're very clever, their brains don't work like ours. They don't think, I heard a bang, so I got tense, so it hurt. So it's not the bang that hurt me, it's the tension, and that's why. They just think, when the bang came, it hurt me.
Yeah, so therefore I
and
don't
what are you
want
going to do?
bangs.
Exactly. And then they're going to get more and more tense and get more, you know, what do you do when you tense up? Your neck goes and everything, doesn't it? So yes,
and I mean, there is a similarity when it comes to learning and learning theories and basically emotion. And if you're experiencing emotion at the time you learn something, you're more likely to remember it, to retain that kind of what you learned from that. And so a bit like us humans, when something is negative, so you're either fearful of your survival, or it was painful, or anyway, a negative emotion, that makes you remember it more. So say, for example, we drove in our car 50 million times already, and then we had one car crash, and people get post-traumatic stress from that car crash, but they've driven 50 million times and been fine, but it's the one time it was bad that we remember and hold on to. So that's the same thing with our animals. If it was a negative thing and they experienced a negative emotion at that time, even if it was all right all those other times, a bit like us, it's enough to keep you remembering it and keep you wanting to look after yourself. Really,
self-preservation, isn't it? If something awful happens, you don't want it to happen again.
Yeah, exactly.
So going back to our original question about this 5-month-old puppy who's already showing signs. Now, most of our puppies aren't going to be showing signs, but that's really pertinent, isn't it? Because we've got a huge amount of puppies that have appeared this year. This is their first fireworks night. If we can give them a good time, that's really going to set them up for success, isn't it? Every fireworks night, every New Year's, every Diwali, every time the fireworks go off. So what would your advice be for a good experience for our young dogs?
Well, ideally every single dog anyway should have a safe haven in your home. So that means that is somewhere where they would choose to go, that they enjoy being, that they can completely relax in. You know, you could find them sleeping upside down in it. That's proper relaxation. That's the
legs in the air, like they just don't care.
Yeah, exactly. And what you might find, and what I have found with lots of referrals, is when we have a fearful dog or something else is going on, and I ask the owner where the dog sleeps at night, or somewhere where the dog properly rests, that may well be in with the owner or in another room or whatever. And then is the dog able to get to that place all the time? So when scary things happen, or when the dog chooses to, oh no, when we go out we shut the dog downstairs, you know, or oh no, the dog's in the kitchen when we go out, but at night sleeps in the living room. So what you're doing is you're saying to that dog, at the time you really need security and safety, you can't get to your safe place, so oops, cope on your own again, you know. So we're almost making things worse. You need to set your animal up to succeed. So yeah, all of these new puppies people have got this year, please do provide them with a safe haven. That can be a crate. Usually it's best put in a corner somewhere and made into a bit of a den, so you put kind of towels and blankets over all the sides of it except the front. I often tie the front door open so it can't shut them out, because we want them to always get into it. Make sure there's water in there as well, so the hanging water bowls are pretty good, because then you can still have a lovely deep mattress.
Oh, that's clever.
Yeah, like, you know, like travel ones, or like a large parrot bowl that hangs. They're brilliant. And then you want to always, when you're introducing your puppy to it, make sure good things come from it. So treats come when they go there, or they're fed in it or near it. Don't ever shut them in before they're ready, because you will create a negative place that will be aversive. So a lot of people say, oh no, my dog hated the crate. Well, what they did was they put their dog in the crate, so it wasn't their dog's choice to walk in with treats, but they put them in and then they closed them in. So they created an isolating kind of frustrating confinement, rather than creating something lovely where the dog chooses to go and lay there whether the door's shut or not. So yeah, that would be my first thing, safe haven. Second thing, and as we all know because we all talk about it, but get things done early. So go on your walk earlier, feed them earlier so they're actually settled, close the curtains, have some noise on, so the TV or radio, and ideally fairly way on for cats, and adaptil plugged in for dogs, and get that going a couple of weeks beforehand if you don't have it going all the time. Create safe places. So for cats, they like choice, so they don't like being closed in and not knowing why, so kind of make it very obvious you've closed the cat flap or something like that. Create, and then provide a litter tray if you're going to shut them in, even if they're not used to using one, because it gives them choice. They have to go somewhere rather than hold it, because that would just create chronic stress.
Yeah, and I think most cats use a litter tray. Most cats know how to use a litter tray, don't they, if they're given the opportunity.
You can put it by their entry and exit point if they you know, they can get used to that. But ideally you do a lot of prep beforehand. It's not just kind of get home on fireworks night, whoops, they're already going off and I'll try and do something, you know. Yeah, and with your dogs or with any animal, but cats tend to try and cope. That cats, they're predators, but they're also prey species, so they try not to show how they're feeling, so they tend to try and cope alone. And often they'll find a bolt hole or they'll go somewhere to hide. A bolt hole isn't the same thing as a safe haven, but it is just an area they can go to cope, whereas a safe haven is somewhere an animal would choose to be because they feel safe in it. But yeah, and then if your dog is actually fearful, you can comfort them, because it's just like a child. If your child is really truly fearful, there's no other way around that. They just need to know it's okay. Providing things like lick mats, Kongs filled with yummy things, really high value yummy things. Again, if you're going to use peanut butter, make sure there's no xylitol in it, because that's toxic to our dogs.
Full fat, full sugar peanut butter,
natural things. And just try and, if it's puppies for the first time this year, try and just create a lovely positive association with the noises outside. So be like, oh, what was that? There we are, here's a treat, well done. You know, rather than leaving them to kind of get worried and then have to mend something.
Make fireworks fun, or at least
you can.
Make fireworks fun for them. And it's interesting that you mentioned the Kongs, because chewing for dogs is a really good stress relieving activity, isn't it? They really dump a lot of anxiety when they chew and when they lick.
It sets off, you know, your rest and digest, your, you know, nervous system. So I think if you think about it, don't leave it too late to offer high value treats, because if they're in fight or flight mode, so their sympathetic nervous system's on the go, they aren't even going to touch it. Whereas if you can get it going and get the parasympathetic nervous system going, rest and digest, yummy, chewing, eating, feeling relaxed, then they're less likely to get up to that threshold point anyway, hopefully.
So it's all about getting them in that good frame of mind, really, before the fireworks start. I mean, it's interesting that you say, you know, take them out for a walk before it gets dark. Well, I mean it's getting dark at like 3 o'clock in the afternoon. I don't know why it surprises me every year. Every year the clocks change and I'm like, why is it so dark already? So on a practical level, it's lovely to be able to take your dog for a walk at 3 o'clock in the afternoon, but not everybody can. And that's, at least I suppose, the fireworks go off, or the worst nights do tend to be the weekends, even if it doesn't fall on a weekend, does it? So I guess if you don't work the weekends, you can just say, right, it's 2 o'clock and we're going to have to go now for a walk and get tired. If
you're coming home from work and you can't walk them that early, then don't walk them that night. You know, it's much better to just go out in the garden with you for a controlled toilet and have treats on you, than to risk walking them and risk sensitizing them and having a lot of my clients actually, and referrals, a lot of their behaviors have been triggered by fireworks going off near them, or loud vehicles doing the back, what do you call it?
The backfiring.
Thank you.
I think
where
they
it's
do
been
that a lot.
slow.
We might be displaying our age there, Hannah, because I think modern cars don't backfire quite as much as they used to.
Or a big lorry or something, you know, something that's noisy.
It's interesting. I was contacted by someone recently, well, this week actually. I put something up and they said their dog had always been fine, and then they walked, you know, it was still light, but someone let a firework off and that was it. The
There
dog's
you are.
whole. But it's interesting that you say that you remember that one negative time. You
Yes,
remember the one time you
like
crashed
we
the car
do.
every time you turn the ignition on.
Yeah.
That dog heard that firework noise, was absolutely terrified in that moment, and then now every time she hears them in the house is also terrified. And you can, you know, when you sort of shift your perspective to their perspective, it makes a lot of sense. They don't do this to annoy us. They're not being naughty or pathetic, are they? Or
No,
over
they're not doing it on purpose. They're not.
No, there's
not,
a good reason for this behaviour.
Yeah. The way I try to describe it to clients is, imagine if you actually felt like World War III had broken out and we had people with guns and snipers and things in our garden waiting for us, that we would actually be so fearful of our lives. You know, everything's completely out of control and we wouldn't actually know where is safe anymore. That is how those dogs are feeling. You know, it's absolute pure fear of survival, you know, pure fear.
And control, that's another really good word. There's no, you know, like you say, that the cats love like a choice. They want to choose where they lie and where they go. Our dogs like to also want a choice. You know, if I'm feeling anxious, I'd like to choose to go and lay on your bed, which is where I like it the most.
Yes.
And then you take away, if we take away choice, or if we say, well, I have made you this beautiful bed under the kitchen table and there you shall lie. You know, so we've got
and
to
if
really
it's not what they want to do or what they find safe, we're creating even more, we're probably adding even more stress
exactly. So I think, you know, we give a lot of this advice out, and I think one thing I've learned, particularly with having behaviour chats, is that it's really hard to give behavioural advice in situations like this because everything is so based on the individual. So when we say you have to make them a safe haven, and you must give them a licky mat or a Kong, and you must, you know, walk them, and you must feed them a big meal. You don't have to do any of that. Those are all the things you can do, but then you have to take that advice, think about your dog and what they like and dislike and where they like to be and what they like to do and how they choose to be, and then work around them, don't you? You know, I think one thing you learn fairly quickly as a vet is you're going to get much more out of it if you work with your patients,
with the owner,
not against them. And it's the same being a pet owner.
It's ideal. It's the ideal situation if you can get them loving a safe haven and things like that. But on a day like, what are we on, 27th? You know, we've got it's next week, or they'll start now, really, the fireworks. So whatever your animal finds the most safe and how safe they feel is what we should be doing now and working towards, you know.
The treats that they love, and I think that's the thing, isn't it? This is the time to spoil them. I spend a lot of my time saying, no, we shall not be feeding them any extras. They just need their meals. We need to get some weight off. Let's cut everything down. This is not the time to stick to diets, is it?
Do it before the noises start. You know, don't wait till the noises start and then try and offer and get them, same as at the vets. Be giving it in the car park, the treats, and in the waiting room, to keep them on that parasympathetic nervous system, on that relaxed, you know, keep them below the threshold. Don't wait till we've pushed them over it and then try, because then there's no way, and they'll probably associate the treat with that time. So well,
exactly. Last time you offered me this delicious Kong, World War III broke out in the garden.
Exactly.
Well, I'm not going to do that again. So we have to be so clever, don't we, to, you know, and you have to take all this advice on board, think about what your pet is like as an individual, and then tailor that approach,
modify it.
And if they want to hide out in the bathroom, which I learned recently is quite a common place, because that's the most effectively the most soundproof room in the house, because it's tiled, so the walls are thicker.
Well, I've found that there's usually less window, and you can't see straight out because it's usually, you know, a bathroom window, but a lot of animals go under a bed or somewhere. They like to go under something and feel, but it doesn't mean they're all right under there, but it means it's the closest place they've found to try and just cope and get through it and hide. So obviously those animals, please don't let them go through that again this year, or any of the next years if that's what they do this year. Please go and see the vet and get started. In an ideal world, if you have an animal with a sound sensitivity, you'd start them on some mood modifying medication early on, so maybe in the sort of January, February of that year, say if we're aiming for your traditional bonfire night, but obviously fireworks go off all year round in some places depending on cultures and parties and things. So but start as far away from the event as you can with maintenance drugs, so maybe some selective serotonin reuptake inhibitors like fluoxetine, which is Prozac, which is, you know, an antidepressant in people, or clomipramine or something along those lines. Get it going, get it in their system, and then do some sound desensitization. So the Dogs Trust website have the sound therapy on there, which you can download, and that's brilliant. Start with that, which is like starting it on a very low firework sound, just on a normal day when they've already got their meds on board, and you're just, you know, with the Kongs and with things that you're teaching them. Some dogs it works wonders for, and some dogs know that is just the CD and that isn't a real firework. So, you know, then, but if and when you then get to bonfire night, so you've had them on it from February-ish, you then also use event drugs on top. So you would use perhaps a benzodiazepine to help with amnesia, and you start it early on in the day. They can have it up to 4 times in a day. So you'd start it on that day so that you don't give it too late and wait for the fireworks to have started, but you get it in their system early, and then you top it up as necessary with the right timings and doses. Or you can then give Soleo on top, which you rub on the gums. That apparently can be given after fireworks have started, but I have had a few anecdotal, you know, reports back that it's actually works better if it's given before.
Well, you can understand that, can't you?
Yeah, because you're not heightened, and you know, it can actually, well, like everything in our world, you know, when we sedate our animals, we then turn off the lights and keep everything quiet, so it works better. So it's the same thing in that way. And then Pexion as well. There's a paper that was out in September last year, and that showed a significant difference between that and the placebo when it was given from 2 days before till a day after the event. So that is actually licensed for that as well now. Which
kind of brings us back round to where we started, really, isn't it? Which is talking about, you know, obviously you and I are both vets, so, you know, drugs are a big part of our lives. And I think I think there's 2 really interesting things you said there. First of all, how far in advance you have to start if you have got one of these dogs, especially who are completely terrified. And there's not many out there. They're not, the majority are not that bad, but
or it's not noticed.
Well, I wouldn't say the majority of dogs need medicating from January onwards.
No, well, I suppose I see referrals, so most of the time
we see a very different population, don't we? But I think also, a lot of people, when you say that, you know, every so often I'll put something out on my pages in like March, April time and say, guys, have you thought about fireworks? Get the sound scary on board. Let's get started. And most people are like, what are you talking about? And I'm like, no, this is the amount, you know, if you want, because like you say, not only is it gets worse every year, so you get this additive effect, and every time a firework or a loud noise of any description, you know, can send your dog from completely fine to absolutely out of their mind terrified. You know, if you've got one like that, you're gonna have it's not a quick fix, is it? But then
we should be and you're right, Kat, probably when we say most dogs don't need it, we should be picking them up earlier when we think they're fine. So when you actually do take a more thorough history of them, you know, because we then spend 3 or 4 hours at someone's house taking history and talking to them, when you actually find out, they might say, well, that year they panted a lot, they wouldn't eat their dinner, and they sat on the sofa instead, but they were fine. So that's where we have to go back to, and the word fine is used a lot, when actually we have to think, when we say fine, is the animal actually fine? Would the animal choose to be doing that? Or is the animal just coping and we've thought, well, it's not really severe, so it's fine. You know, they've not chewed up the sofa, so they're fine. Or they're not howling, so they're fine. It could be with then, you know, lots of owners say, or in the car, oh, he's fine in the car. Well, actually, he can't lay down for a 10-hour journey because he's too stressed, but he's not howling or annoying them, so he's fine. So it's really,
fine is a relative thing.
Yes, really important to define what the animal, or for us as the vets and vet nurses and receptionists working with these clients ask a bit more, say, okay, when you say he's fine, what does he do in the car, or what does he do during fireworks? So that, oh, he just hides and he doesn't eat his dinner. Okay, well, now's the time to get on board with that dog, you know, and on top of things. Don't allow that to get worse.
And that's why referral to a behaviourist like yourself is so important. And I think that, you know, I'm a first opinion vet. You are as well, obviously, but you have the behaviour side of things. And we see so many people in and out every day. And there are so many dogs, particularly, that probably do have some issues. And I encourage people all the time to seek professional advice. And I think some of the times they're really not that keen. It's quite difficult to persuade them, you know, because yes,
it's not affecting
if it's not
their
a problem
life
for the owner, they don't perceive it as a problem for the dog. And until it becomes a problem for the owner, so until the dog is howling or destructive or so obviously terrified that they then feel we have to do something about it, you know, especially behaviour. So much behaviour. I mean, again, we're getting off topic and we're way over time here, but so much behaviour is, I think so many behavioural problems are missed. And so many dogs live their life on an anxiety edge. Think of all the ones that can't go off the lead or aren't very good with other dogs.
Or can't be left, you know, separation ones. And I've had, owners only come for help once they've had a warning from the council, you know. They've known their animals can't cope, but, you know, they kind of live with it. Whereas we need to get in there a lot earlier if we can, you know, and prevent this. Prevent it getting worse, really, and therefore have better quality of life for the animal and welfare as well as the owner.
Precisely. And then we're not doing like emergency level behavioural,
exactly, which is so much harder. By the time you see them, it's so much harder, and sometimes not completely curable, but just getting them down to a manageable level, whereas if we'd have got to them when they were fine, you know, potentially we really would have been able to help them.
And the way I think to solve that problem right now, you know, if there's anybody watching who has heard us talk and has been patient enough to listen to us all this time and are now thinking, actually, I'm not sure my dog is fine with the fireworks right now, the answer, I would say, is medication, isn't it? We're not going to start any desensitizing programs now. We're not going to do anything along those lines, are we? You know, we're going to have to, in the nicest possible way, just drug them up and get through it and then start again next year.
To prevent further trauma now and then work on it after New Year's Eve. So drugs for now, drugs for New Year's Eve, and then after that, January-ish. Start
in January. That could be, if you have a dog with firework problems, we've done your New Year's resolution, haven't we?
Yeah. Good point. Right, I was just going to read that other question.
One more question. Just you read it. I'm just have to
be a parent. Okay, so Vicky has written, our vets were recently approached by several owners of dogs with medical conditions, cardiac patients and chronic kidney disease specifically, all with intense firework fears, inquiring about medication for the upcoming firework period. We were wondering if there are protocols that would be safe to implement with these patients, either for the event or for longer term, or would we have a look at it case by case? Thank you. Well, that's a really good question as well. Again, yes, it is always to look at it case by case, but with regards to the medications, a lot of them will say whether there are contraindications in the data sheet, in the formulary. So when with Pexion and Soleo, they're the two that are licensed for sound sensitivities, or phobias as we call it, which phobia is defined as an irrational response to something that is not baby brain doesn't need it,
just a completely over
irrational, basically.
Irrational.
Pexion's was described as the contraindications where it shouldn't be used with severely impaired kidney, liver or heart function, but that did say severely impaired. So again, it's on a case-by-case basis, and if it's being used for a short period, you could go for the lower end of the dose, you know, as your vets, as you see fit, and having taken bloods and done a clinical exam and things. So
and I think you can always ring the technical teams, can't you? You know, from this is advice for veterinary surgeons, but you can always ring the drug company technical teams, because they are always absolutely full of information. And also, you know, fear is a welfare issue. If you have got a dog that's out of its mind during fireworks, that is a significant behavioural welfare issue, isn't it? Really,
and it won't be helping its cardiac disease anyway, you know. So
it won't be helping anything. So I think, you know, informed consent, sensible decision making, and, you know, medication trialing is always the way forward, and all of these other things, you know, safe havens and adaptil plugins and all of that jazz. But if you've got those cases, you just ring the specialist, ring the behavioural vets, and, you know, you could always ring maybe somebody like you or the team at the Behaviour Centre in Cheshire, who are fabulous, especially for advice. I've rung them myself.
There is a list of veterinary behaviourists, qualified veterinary behaviourists on the ABTC website. So again, if any of the vets or vet nurses needed help quickly, you could probably contact one of us through there. But I had a very old girl, Chihuahua, with really end stage heart disease, but still would use a little bit of Soleo for the times that she was worried and try and prevent her stress. And it, you know, that was, for me as the owner, informed consent and, you know, all of that, that was definitely the best way to go about her preventing her getting stressed.
Yeah, and I think probably we better wrap it up there, but I think that's a great place to wrap it up on, is every pet can be helped through fireworks, whether they are a 5-month-old puppy already struggling with noise phobias, or a 15-year-old Yorkshire Terrier with a long list of other chronic problems, but also struggling with fireworks. There is a way through it for every pet, and every pet is different. But, you know, my final message would be, call your vets, give us a ring. We are fielding calls right now about fireworks, and we're going to be doing it, you know, for the next fortnight. So please give us a ring and let's talk about it, because we can do a lot. You know, drugs are probably the way forward at this time, and they are brilliant and they are safe and they are effective, and we can help you get through it. And then for moving forward, I would pass my clients on to someone like you, Hannah, who can do the long-term fix. There's a short-term and a long-term solution here for every single animal.
My final word would be as well to, if you need help, check out the articles and handouts that we have on the APBC website, available for anybody to look at, and the fabclinicians.org website also has a load of articles, all by qualified behaviourists writing them and to help you. And also, secondary, don't wait till your animal is too fearful, is what I would say. If we can be preventative now, if you don't know how your animal's going to be because you've not been through a fireworks session yet, then be preventative now, make it great. And then, or if you know your animal is going to be fearful, just like Kat said, let's help them through it and give them the correct medication.
And fine isn't always fine.
And fine is always fine. Hannah,
that was fabulous. Thank you so much. Thanks very much for inviting us on. And yeah, we blathered on a bit, but I hope everybody enjoyed it.
Sorry everyone, hope there's something useful in there for you. Rosie did say if you have any further questions, please do get in touch with the APBC afterwards, and we can always try and answer them for you.
Great.
Thank
Bye.
You.